At the sound is ready.
All right. Good evening, everyone. Thank you for joining us. My name is Amy Tausch. I'm a mental health consultant at the Pan American Health Organization, which we call PAHO. And this is part of our BVI MHPSS Webinar Series, which is part of a project between the Pan American Health Organization and the government of the British Virgin Islands for mental health and psychosocial support in disaster management and building individual and community resilience, which is funded by the Caribbean Development Bank. So tonight, the topic of our webinar will be coping with COVID-19 stress during the hurricane season. We have Dr. June Samwell from BVI Health Services Authority, and also Dr. Cayetano, Mental Health Advisor from PAHO with us. Before we get started, just let you know that everyone's mic is muted. We will save questions until the end after the presentation. And also just a heads up that when the event ends, we would greatly appreciate your taking a very brief survey on the quality of this webinar, which will be sent to you automatically when it's over. So without further ado, I will pass it over to Dr. June Samwell. Dr. Samwell, if you'd like to introduce yourself a little bit more. Oh, I think your mic is actually on mute.
Hi, good afternoon, everyone. So I'm Dr. Samuel. I'm a psychiatrist practicing for the last 20 years as a psychiatrist. And I currently work with the inpatient services and support to the community mental health services in BVI. And I'm really happy to be here to really present this information on stress and coping with stress during this peculiar time that we're living in. So I hope that you find the information useful, and we will get started. Questions will be at the end. So we want to talk today about, just give me a chance to get this set up. Right. All right, so we're talking today about stress during this time, and these are the objectives that we've decided on for today. We want to learn about the stress response. We want to understand its relevance to the current situation that we find ourselves in, and we want to learn some strategies to manage our stress response, as well as improve our overall ability to cope. And one of the goals that I have is that we want to ensure that you have practical strategies to apply. So I want you to take a focus on this slide, and I want you to, part of managing stress is managing our breathing. It is a simple technique that we can use. So I just want you to focus on this slide for a minute and sync your breathing with this slide. And let's see how well you're able to do that. And we're going to do that one more time. You're going to be breathing in, and then you breathe out. And we'll do that one more time. Breathe in, following the slide, and breathe out. And feel yourself relax. And that is one simple strategy that you can use, which you'll see coming up again at the end, in terms of managing anxiety that you may feel during this stressful period. So what is happening at this time that is causing us higher levels of stress? We have the unfolding of a pandemic. It continues to unfold. Varying countries now having second waves. We in the BVI, we're now having a spike of cases. So we're under some new movement, sheltering at home, stay-at-home orders. And on top of that, we have the hurricane season, which, is not new for us, but it is happening within a pandemic. And because of that, then it creates a higher level of stress. And all of these things happening together call for us to have significant cultural and behavioral change, But if we do it well, we will become more mentally resilient. So not only is living in a pandemic a significant change for us in terms of our lifestyle, but it requires of us multiple changes in how we behave culturally, socially, and even from a financial perspective. The pandemic was declared in March 2020, and since then, we've been having multiple changes being kind of pushed upon us. You know, we have to change, limit our expressions of affection. We have to wear masks every day. We have to stand 6 feet apart or 8 feet. Our practice of having home gatherings and parties have to be now under different rules. Culturally, we go to church, and that is now being curtailed. Working from home, homeschooling, having kids doing school online.
And maybe you can switch the display, because we're seeing the notes. So maybe if you click on where it says display setting, you have two computers, I guess. Or,
No.
Okay. Yeah. Now it's fine. No.
It's fine now.
No, the other one. Click on the display. There's a line that comes down. Yeah, right there on that display. Okay. Again. Okay. Let's see again if you, because we get the notes. That's what happened.
Okay. Well, let me just go to.
I thought it was the display section. Oh, okay, fabulous, yes.
That's better?
That's much better, thank you.
Okay, so with all of that, we have all of the financial, the economic and social upheavals that are associated with the mitigation measures for the virus. So what do all of those changes make us feel? I want us to stop and think about what we're feeling, and can we name what we are feeling? We may be feeling anger, sadness, irritability, fear, anxiety, or just feeling overwhelmed and longing for things to be normal. And those feelings then add up to us feeling stress. But for most of us, you know, having stress is a major feature in our lives right now. And apart from our individual challenges that we may be having, living with this pandemic and adding what's predicted to be an active hurricane season increases our level of stress. So these things affect us physically, but they also have repercussions that affect multiple areas of our lives. And so our systems have to respond. Our body responds to what we perceive to be this whole environmental change, and makes an assessment of whether or not we can respond to this threat, what could be seen as a threat. So stress really is a normal reaction to everyday pressures, but it becomes unhealthy if it affects our day-to-day functioning. And when we encounter situations that we perceive as being stressful, our bodies produce stress hormones, adrenaline and cortisol being two. And basically what that does for us is that it triggers for us to respond to the situation. And this slide shows essentially the effect of stress on the body. So it affects all of our systems, okay? We may have, it affects our brain. We would have difficulties with concentration. It can affect our musculoskeletal system. We can feel muscle tension, muscle pain, joint pain. It affects our immune system, affects our heart rate, our heart. So we have palpitations. We feel our heart, racing. We get upset stomach, diarrhea, all of this wide-ranging series of responses that our body puts out. And basically what the body is trying to do is to prepare us to either stay and fight what is happening or to run away from the situation. And of course, during those periods of stress, then what we start to feel, we feel uncertain, we may feel powerless, we may feel like we want to avoid the situation, or we become paralyzed with fear. So we're not sure what to do, where to go, and how we should react to the situation. And this slide here shows all of the various parts of our being, I like to say. So our body, our mind, our emotions, our behaviors are all involved in this stress response. And because we have all of these feelings going on at the same time, we may feel overwhelmed and we may not be sure of how to respond. Okay? And just to point out that, there are different types of stress that we may be experiencing. So stress can be either acute as a response to a situation. So we find ourselves in a situation where we immediately have to respond. So we're preparing for a test, we're preparing for, we walk into a situation where our lives are threatened. That we then respond acutely to that situation. But we should return to a resting state without any negative effect on our health. However, if that stress response is activated repeatedly and persists over time, it results in chronic stress, and chronic stress can now have cause responses in our system that basically cause medical complications, health complications. So we can have increase in blood pressures, as we have increased risk for heart attack and stroke. We can develop weight gain because of elevated cortisol levels. So the chronic stress becomes a concern. And if you think of the situation that we're living in at the moment, it is a situation that we could easily say we're living under chronic persistent stress. So you're going to take another breathing break because I've said a lot. And I want you to practice breathing because it's the simplest thing that you can do to manage your level of anxiety associated with stress. So, done that a few times, on to the next. So we're going to talk about some of the stress-related things specific to COVID. Of course, by now, we all know that COVID is a respiratory illness caused by SARS-CoV-2. It's a novel infection, started first in December 2020. And we know that persons have symptoms ranging from mild to severe, and those symptoms show up anytime from 2 to 14 days after exposure to the virus. The pandemic was declared in March 2020. So, we all should know the same variant symptoms, because part of managing our stress is knowing how to respond to what we may be experiencing. But the American Psychiatric Association has warned that COVID-19 will have negative mental health effects that will be serious and long-lasting. And we've started collecting, data has been collected that shows that there are a number of outcomes related to things like confinement, so isolation and quarantine, right? So there's an increased incidence of stress, confusion, depression, anger, and irritability, and that's specific to this pandemic. There are stresses associated with COVID-19, specifically being diagnosed, coming up as somebody that has to be tested. Persons get anxious. They have changes in their sleeping and eating patterns, difficulty concentrating. In some instances, suicidal ideation and substance use. And, we've also noted that there's worsening health conditions, chronic health conditions, and or mental health conditions for persons who are living in this era and having to cope with it. Okay. Right. And so the APA has annually conducted, this is statistics out of the US now, a Stress in America poll where they look at the level of stress that Americans are experiencing. And what they found essentially is that when you compare what's happening now in 2020, there's been a significant increase in the level of stress that persons are reporting that they're feeling when you compare from 2019 to this year. Now, of course, we haven't done this in BVI. It'd be interesting to do it here, but I am pretty sure that most of us will admit that, generally speaking, we feel more stressed, okay? And then we have the hurricane season. So we know, we live in the BVI, we're used to having this season. It runs from June the 1st to November 30th every year. The predictions this year says it's going to be above average. But in the BVI, we were affected by Hurricanes Irma and Maria in 2017, and that experience left persons feeling traumatized and some persons not having completely recovered infrastructurally. So, there's a level of anxiety normally associated with the hurricane season. And then you add that to what's happening with COVID, and we're having to remain vigilant and prepared all the time and responding to repeated cyclone warnings and watches. And, we know that creates a significant level of anxiety in the population. So acute stress is considered to occur, within the month after the exposure to whatever may have triggered that stressful response. But chronic stress, after that month, we then talk about persons experiencing chronic stress. And, the thinking now is that in our current circumstances, we are now considered to be living in a chronically stressful situation. So how do we cope? We cope by using stress management techniques. So the first one is we need to develop a level of acceptance and awareness. So first of all, accepting that the situation is what it is, but also developing a level of self-awareness. And self-awareness means being aware of your body's response to the situation that you're in and being able to identify when your body is sending you those messages that you are experiencing a significant amount of stress. Stop, you note what is happening, note what you're feeling, and develop a plan to respond to what you're feeling. We need to accept that the current situation will continue for a time, for a little bit, right? So there's no going back to what we consider our normal lives, because the virus now lives with us and is essentially a part of our lives. So that is going to dictate some of what will be happening in our environment. Stress management tip number 2. We want you to take care of your physical health. So this is something that, most of us have heard and we keep hearing about it. Eating healthy, balanced meals, paying attention to building your immune system resilience. In the BVI, the CHIP program has been launched, and that can help us if we think that we need that sort of help to comprehensively improve our overall health. So that's a tool that we can look to use. Exercise regularly. Exercise has both physical and psychological effects, and you really want to be exercising three times a week is minimum for 45 minutes to an hour, but exercise every day, increasing your steps more than 10,000 steps per day that is what you really want to aim toward. Sleep is important. Adequate quality sleep is what I like to say. And we know that sleep is important for repairing and rejuvenating the system. But you want to look at your sleep hygiene. You want to ensure that you're getting good quality sleep. You set your sleep time and your wake up time every day. And you become almost obsessive about having good sleep. Avoid excessive alcohol and drug use. So, very often when we're feeling anxious or we're feeling stressed or tense, we try to self-medicate. So use of alcohol, use of other drugs, marijuana, cannabis, use of caffeine. So avoiding excessive use is important because that creates other problems. Number 3, so taking good care of your mental health. So, as the picture shows, having good mental health and good physical health are both important, and that creates then a healthy individual overall. It's important to educate yourself about the nature of stress and understand the effect that stress has on you as an individual, because each of us responds differently to stress. So we have to be aware of what our particular symptoms are so that you can respond to that. Also, acknowledging that feeling some level of stress, stress is not good or bad. It is how we respond to what we're feeling that's important. And having some stressful reactions may be normal depending on the situation, but we don't expect that the stressful reactions will persist. And then we want you to engage in relaxation techniques. So when you're feeling overwhelmed, there are various things that you can do to relax. So taking long, slow, deep breaths, just practice that. Right? And that is important, because when we feel stressed or anxious, we tend to shallow breathe. So we don't take in enough breath, and we compromise our system, because then we don't get adequate supplies of oxygen. So deep breathing, works to help to start the relaxation response. Engage in enjoyable activities. This is different for everybody, each person. Listening to soothing music, spending time with nature. So most of us have rediscovered this with COVID, gardening and going for nature hikes. One of the things I've started saying is, okay, there's a positive out of COVID, which is we've rediscovered the BVI and all of the places we can go to that are actually peaceful, right? And can help us to relax. So looking at that is as a way to relax is important. Meditation works. Meditation helps us to control our thoughts and to control even our breathing. Okay, and these 2 apps that I have listed here, I recommend highly. There's a Smiling Mind app, and then there's Headspace for persons who are new to meditation. I find that they take you through and help you with your body scans and the relaxation. So those are 2 good apps that you can refer to. Tip number 4. So you want to develop a routine. So one of the things that COVID has done is it has caused a lot of disruption. There's been disruption in our home lives, disruption in our work lives, school lives, and each time we think that we have a routine down pat, then something happens that makes us have to disrupt that. But it's really important to structure your time. So within whatever situation you may find yourself, establish a routine so that you can have some sense of normalcy. And this is particularly important to where there are children in the home. Try to incorporate things that you did normally before, right? And regular activities with other persons. So although we have to physical distance, we can still interact socially using the technology. So we should try to incorporate those activities. Stress management tip number 5, social support. Social supports are really important, okay? And I know in the BVI we have persons who live and work here who may not have, family support. They may be here on their own. So having social support, a support group, persons that you can talk to, that you trust, that you can get support from is very important. And your support system can include families, friends, other loved ones, your faith-based persons within your faith-based organizations, service clubs, other professionals. But identifying and having, it doesn't have to be a big group, but persons that you can bounce things off of and feel free to speak and that they would support you. Stress management tip number 6. So in spite of doing everything that I have mentioned, you still may feel distressed, hopeless, and have difficulties functioning on a day-to-day basis. Remember I said that, our current situation is likely to continue, and therefore, over time, we may find ourselves really not coping or not functioning as we're used to. Then it's important to reach out for help. Professional intervention is important, and it can include just therapy or medication or both. Okay, and at the end of this presentation, I give you some persons, a listing that you can use. So stress management considerations specifically for COVID. The major source of stress, I am saying, this is just my personal opinion now, that the infodemic, there's an epidemic of information associated with COVID-19, and that creates for individuals a high level of stress. And of course, because we now have, all the way we work and live has changed, we become more reliant on technology, and so you're bombarded with information. So you have to manage that. So you minimize what you read, what you expose yourself to, and if you find that it is causing you a lot of anxiety and distressing feelings, then you choose when you will tune in and when you will tune out. For information, use reputable sources. So, we've been here, we've heard about the whole challenge around misinformation and rumors and fake news in BVI, around COVID and the things that are happening. So choose your trusted source and stick with that, right? And if you're sick and concerned about COVID, you need to know where to get treatment, where you can go to get tested, and who you can reach out to for support. And then stress management around the hurricane season. So the DDM website has a manual that they've done, and I encourage everyone to go to the website and get a copy of the manual. It's excellent. It talks about preparing for the hurricane season during COVID. But the main thing is we have to remain prepared during the season. So a part of managing your stress is knowing what your plan is going to be, right? And if you think about it, being prepared for the hurricane season applies for COVID, because a part of what the mitigation strategy in COVID may be that we have stay-at-home orders or lockdowns that will occur from time to time, depending on what is happening. And therefore, having your emergency food, water, and medical supplies is important. So if you haven't stocked up already, you should be stocked up. And there are checklists that tells you what you need to have and how much you need to provide based on your family size. We suggest if you have chronic diseases that you have at least 2 months of medications always available, and that is something that's available here, that is allowed here. If you know that you're going to have to go to a shelter, you should have your emergency bag ready. And the main thing is to remember that you're going to have to mask up, you're going to need gloves, you're going to need your hand sanitizer. So you need to include those now into whatever your emergency bag would have been. Prepare to evacuate if you know if you live in a situation where it's risky, if risk for flooding or, with wind and the hazards associated with that. You need to have that to-go kit ready with the personal items that you will need. And as I said before, because it's COVID-19, you have to include these other things: hand sanitizer, disinfectant wipes, and 2 masks per person, right? If you're going to be checking on friends and neighbors, you're going to follow the social distancing recommendations. And you need to know where your safe place is going to be. So if it's going to be at a family member, then you need to make sure that, it's set up for social distancing, that is going to be safe. If you're going to go to a shelter, you need to know where that shelter is that you may need to go to. And then for sheltering with hurricane season, these are things that we should know already. As I said before, know where your shelter is, and remember that you're going to have to practice all the current protocols. So the social distancing, washing your hands, there are going to be policies in place to try to keep everybody safe. So you have to prepare your mind that if you're going to be in a shelter, that is, is going to be a little bit different than what you may have been used to before, okay? And of course, if you feel sick, you should let the shelter staff know. And if after a hurricane, you do the things to keep yourself safe, continuing to observe the protocols related to COVID. If you get sick or injured, you need to know who you're going to contact for treatment. And if you're going to use a generator, make sure that it's properly in an area that is that's open. But so disasters, can cause stress and strong emotions. But once we prepare our minds that, this may happen and have a plan, then that will help to decrease our level of stress. And you need to have a plan A and a plan B. Persons who have pre-existing health conditions, remember that you're at risk. And therefore, you need to be monitoring yourself for any worsening of symptoms of your illness that may happen. And it's a stressful time for all of us, but we can all cope and learn to cope with the changes. We have to actively use the stress relief techniques. So the deep breathing, relaxation, schedule the time for ourselves, take time out as you need to. Be self-aware of what your body is feeling and respond to that. Educate yourself about the ongoing changes with COVID, as well as keeping up to date with what's happening with the hurricanes. And if you do experience difficulties coping, then you reach out for professional help. This is a listing of resources in BVI. Many workplaces have employee assistance programs. Make use of them, and the services are available both privately and at BVI Health Services Authority. So there's really no reason why we cannot get help if we need to. And then remember that when you can't control what's happening, as we may feel now, challenge yourself to control the way you respond to what's happening, because that is where your true power lies. And that's the end of my presentation. Thank you very much. I have references, and I guess we'll probably send this out, and you can access the information on all of the different websites. Thank you.
Thank you so much, Dr. Samuel. Yes, we can share the presentation as well as the recording of this webinar with everyone a little bit later. Let me just share my screen. We developed some questions to kind of engage discussion, and maybe Dr. Cayetano, I'm not seeing Sidra with us, but maybe you can help us with the discussion, the question and answer part.
Thank you very much, Dr. Samuel. You're such a good presenter. I think your breathing is definitely very, slow, manageable. So even your way of presenting makes one feel so calm. One of the things that while Amy is putting up the questions, and we'll ask the participants to please raise their hand if they have a question, or they can actually, write it on their chat. Is that there's a way. It's not the same. The stress, the coping with the stress, as when you are facing, for example, when you're facing COVID, and if you're facing a hurricane. So when we started this in terms of the building your coping skills. Remember, in terms of putting all of those things together, and I think this is what's also important, because everything that Dr. Samuel is guiding you is to help you to become more resilient. Some of you, I don't know how many of you are familiar with this program that we have with BVI, where we also work with the community, work on community resilience. So for the hurricane, you also need to make sure that you think of that. So this is what taking us to our question number one. What is the difference between coping with stress during hurricane and coping with stress during COVID-19? I am unable to see if the hands are anyone. Don't compete for the mic. It will be good to get some feedback from you. What do you think is the difference? You will not be able to unmute yourself, but if you raise your hand, so there is you can click on your name and you raise your hand, and then my colleague Amy will be able to unmute you. It's just that if we unmute everyone, then it becomes very difficult to hear sometimes. Should we unmute everyone, Amy, you think? I don't know. We don't want to class by name. We just want to encourage you to. So the questions that we have here for discussions is one, whether there's a difference between coping with stress during COVID, and the other one, why is it important to understand your values in dealing with stress? And the other discussion is, question is, how do children express stress during hurricane? Can we prepare ourselves mentally to face the hurricane season? If so, So what your thoughts are about that? I think this is when we want to take. We still have 15 more minutes before ending the presentation. So we are interested to engage and get your feedback on any of the questions.
And I think also any questions for Dr. Samuel and her presentation are also welcome.
Definitely. Thank you. Should we ask, some of the participants, Dr. Samuel? You don't want to.
I do. Oh, Miss Ford.
She's asking a question. Hi, Miss Brenda. It's so good to see you with us. I know, Miss Brenda. Hi, Miss Brenda. Feel free. Can you, maybe, Amy, you can unmute Miss Brenda?
Yep, she's unmuted.
Okay. Hi, Miss Brenda. Good to have you in the webinar. Welcome.
Hi, afternoon. It's good to be here.
Hey.
I would say that there's not really any difference between coping with a hurricane and with COVID, because they're both stressful. and using good coping strategies would be helpful, especially, breathing and exercising and eating right and getting the right amount of sleep. So I think all of those strategies are necessary, whether it's during hurricane or whether it's during COVID, and just, encouraging ourselves with positive thoughts instead of the negative thoughts that will creep up, and having hope and, just thinking of the positive things. I think is important in either situation, in both situations.
Thank you, Ms. Brenda, and it's so good to hear you, and with the positive recommendation, and again reinforcing the importance of breathing. And you're quite correct. It is how we respond to these stressors, right? Anybody else that would like to?
Yeah.
We do have hand up. I'm going to unmute Leslie's mic.
Good evening, and I'm very happy to be a part of this presentation. Thank you, Dr. Samuel.
You're welcome.
In my opinion, I think there is a difference between the hurricane and actually coping with COVID, because you know in your mind, all right, June 1st to the 30th of November is hurricane season. All right, so the days after that, you don't necessarily have to worry about something coming to mash up your house and take away everything that you've worked hard for. However, for COVID, there is no real time frame for us. So mentally, you have to keep just shifting around yourself, getting acquainted to curfews and protocols and guidelines. Whereas for hurricanes, you have a different timing where you can anticipate something. That's all I have to say.
Great. Thanks for that. Great.
Dr. Trotman is there too. Dr. Trotman.
Dr. Trotman.
Yeah.
And okay, Ms. Nurse Duran.
And we have a comment from Althea now.
From Dr. Paula Trotman.
Trotman, yeah. Dr. Paula Trotman, yes. Let me unmute her. Maybe you can unmute Dr. Trotman, Amy? Paula Trotman?
Sure.
Thank you. So while Amy is unmuting Dr. Trotman, and I think it's also the issue of the type of the stressor. So hurricane is kind of predictable June to November. I think this is the point that you're making. One, but at the same time, that's one issue, and the other thing too is that the public health measures are different, but it's about how you're preparing. This is what we want to be able to encourage each one who is connected to this webinar. But let's hear Dr. Trotman. Your mic is unmuted.
Okay. Good evening, everybody. It's great to be part of this this evening. The previous speaker mentioned, about the duration and the time frame, and it made me reflect on something my 9-year-old said during the beginning of the COVID lockdown in March. She was very anxious because it was something unusual. And I asked her, I said, we've been through difficult things before. We survived Irma. And she said, but Mommy, Irma was a short event that we knew we were going to recover from. Mm-hmm. And we don't know when this is ever going to end. And unfortunately, I had to tell her just this morning, school isn't going to resume the way we were planning for, and explain to her why that was. She took it remarkably well. But we still have a lot of people here, adults and children, who are very fearful, very, very hypervigilant with every storm system that is coming. Mm-hmm. And then you have that added hypervigilance with, certainly with some of us in healthcare. I work in employee health. For me personally, I am incredibly careful in terms of, well, who am I in contact with, and what level of contact is that, and am I protecting myself? But I think that we're struggling a little bit with a disconnect between some people and what's going on over there, because maybe it's just too much. So we're trying to pretend like it's not happening, or maybe it's not pretense, it's a coping mechanism. But that's going to get us into difficulty if we can't encourage people to find the right coping mechanism. So I'm very grateful for this exercise.
Thank you.
Yeah.
I mean, the other thing that I wondered about is exactly what I said in the presentation. So, the stress response, as you're saying, Dr. Caetano, is the same, but, the on again, off again that we have to go through with the hurricane season, especially now. So, you're on again on a watch, and then you're off, and you're having to think about who you're next to for COVID. I mean, I believe that it's not that there's a difference between the coping, but I think it's just the waxing and waning of having to go through that response, if you may, and then the ongoing nature of it all, as Dr. Trotman said. I think, from my perspective. So.
Yeah. Thank you. And that you're right. Everyone who's being expressing their opinion, I think it makes sense in terms of thinking of the impact. And it's not only hurricane. I think in BVI, Dr. Springer was talking about the seismic changes, earthquakes. So that's something to keep in mind. So definitely it's so important to find ways of coping, that is positive, because if you're not coping positively, then people end up using drugs, using alcohol, and like you're saying about the chronic impact of stress. So I think this is so important, and I like all these tips that you're giving about the walks and the walk and the nature. I like all those tips. I think people can take advantage, because it is that when your mind is clear, then you make better decisions. When Dr. Trotman was speaking, I was wondering that since she talked about her child, 9-year-old, whether you think like how children express stress. Maybe that was something it's also good to talk about, because sometimes, in our culture, sometimes we think kids are not to be.
Yeah. So I didn't address that in this presentation. I think I focused more on adults. I guess we're gonna do something around kids, but maybe Ms. Foy can weigh in on that a little bit too. But we have Rodney Brathwaite has his hand up.
Maybe you can unmute. Yeah, thank you.
Good afternoon, all. Good afternoon.
Good afternoon. Good afternoon.
Great presentation by Dr. Samuels. Great coping mechanism strategies. But for me, with COVID, is not only the stress of, I think the additional stress to COVID is worrying about what the next person that you're going to come in contact with is doing. And for me, that's a bigger stress than knowing the other stuff, because it's like the contact tracing part of it. So it's like I might do whatever I have to do, but then I still stress about what the other person that I'm going to come in contact with is doing. In terms of the hurricane, I believe that the coping mechanisms are great, and as the other presenter said just now, thinking about all the other natural disasters that can occur, especially here in the BVI, those coping mechanisms are also great. So it's not only the hurricane, but we have to worry about the earthquake, and then when you hear the tsunami warning, if there's one, all of those additional stresses are there. But the biggest thing for me with COVID is worrying about what the other person you come in contact with is actually doing. Because you might do everything possible in your powers, and then some other person decides we're not going to do what is supposed to be then they expose you unknowingly to something that is going on.
Absolutely. Before I comment on that, I want to get Nurse Althea. Her hand was up.
Oh, yes, yes.
Amy.
Yeah, Amy.
Not seeing it now, but her hand was up.
You can actually unmute again, Dr. Trust. Yeah.
Okay, good evening to everyone.
Hi.
Good information so far, really enjoying it. My concern too, I worked right after Irma Maria, right there, and my concern is the stress is that I can actually see the danger in being out there taking care of my clients, I work in the community. So I can actually see a falling wire and a falling tree and decide I'm not going to pass there because this is dangerous, whatever. With COVID, I'm not sure who I'm dealing with. And even if I go to a client who appears to be doing the right thing, I'm not sure who is living with them and who they interact with. So I'm always on the high. So it's the stress is just different.
Yes.
Because I'm still in the community, I have the same clients. They may come to me looking clean and nice and trendy and their mask on and everything else, but I'm not sure who's in the house with them, who was there, who have not been there. And with my daughter who is 12, she told me, you know something, I'll go back to 2019 because 2020 is not working out. So far, 2020 is not working out at all. Let's go back to 2019. So this is not working out. I am not understanding this. This is nothing I've planned is coming through. And this is not right. She can't understand, she said she can't understand 2020. It's supposed to be a big year, 2020 vision, and she's not seeing anything in the vision. So there's no vision so far for her, and she's only 12. But honestly, the stress levels are different because I have the same clients, I'm in the community, but I can see the fallen tree post-hurricane. I can see the wires on the ground. I can see where I should not pass. With COVID, I don't know where he is or where she is. Is she or she or he? I'm not sure. But I'm not sure. So my stress level is just different. As to my level of awareness, I'm always, what do I do? Do I make, you're just not so sure. You're never sure. So the level of coping is just different. Up to this point, I'm like, what is really going on? I ask myself, what is really going on? I'm still asking myself, what is really going on? Because schools are back to online, and with the COVID, you can't decide I can decide, okay, I want to shop for that amount of stuff during the hurricane season. With the COVID, today the supermarkets are open, tomorrow they're closed. You never know what.
Yes.
You don't control where you go when you go with COVID. The hurricane, you can say, okay, it's safe to go out now. The COVID, you can't decide. The government says you can't go out, you can't go out. With the post-hurricane, you can decide to go out if you want to. That kind of way. And you can actually see the changes and the improvement in the environment. Because you passed today, there was a window replaced on this building, and the next day is a door. So you're like, okay, things are coming back. With the COVID, you're never sure if it's going to come back. We're still not sure. So that's it.
Especially now.
Excellent.
Thank you. I think it's Miss Ivy too has her hand up. Miss George. So Mike, is she muted? Amy? Miss Ivy George. Go ahead, Miss George. I think you're unmuted.
Good evening. Thank you, Dr. Samuel. What I wanted to stress is that we are now in the half of the hurricane season, and we are also right now going through a situation where we are where we are focusing on COVID. From my experience, we have shelters, but some communities, they don't have shelters, and the shelters, many of them last time were not suitable. So therefore, people in the community end up going to neighbors' homes. So I think we need to put some measures in place. I don't know if it is your department, or maybe we need to work with the surveillance unit and DDM to put something in place that will say to people that we know this might happen, and if we have a situation where we have a hurricane and people need to, your neighbors are knocking on your door, what kind of measures we need to put in place to ensure that we don't compromise ourselves with COVID-19. I think that is something that's going to be very important.
Thank you, Ivy. I agree. Yeah.
I'm making notes of that. I think that's a very good intervention.
Very good point. Yeah, because that's an excellent point, Ivy. Thank you for that. And I take the point that the other persons were making before, because even in my own personal experience, you do what you're supposed to do, and then COVID can become really very real because, I took a staycation, went to Anegada, and ended up being in Anegada that week that this whole thing came out about contacts in Anegada. So imagine you take a week off, and then the next week you spend stressing about, okay, did I come into contact? Did I not come into contact? So it then makes it very real for you, and it's so important that not only the whole self-awareness, being aware of what you're doing, but also looking at what other people are doing and trying to ensure that their behaviors are appropriate to protect you. I think is a part of what we have to now do, and what makes this whole COVID, the stress-related dealing with COVID a little bit different.
Okay, do we have time for just a couple more comments? Rodney would like to say something, and then Paula.
Paula, go ahead.
Go ahead.
Following on to what Dr. Samuel, thank you very much. Following on to what Dr. Samuel just said about certain things making things real for people, as the occupational health physician at Health Services, when we then had our first admission for this new group of cases that we're seeing, and people realized that they were in contact with that case, we've then seen a change in behavior in terms of the staff trying to be more consistent with mask usage. Even though for weeks and months we've been encouraging them to pattern a particular level of behavior, you'd speak to them about the masks and they would tell you, oh, the mask is going to kill you and they can't breathe. And you'd hear these weird and wonderful, fanciful stories about why they shouldn't comply with a request, an order that was given that they should protect themselves and others in the clinical spaces. And then the following afternoon, after people became aware that people may have been compromised, we then saw this miraculous change where everybody was masked and everybody had shields and everybody was doing everything right. And it's a week later, and everybody isn't doing that anymore. Some people are, but it's really difficult to encourage people, grown people, adults, to pattern the right behaviors and to let the people. There really seems to be this sort of denial that we keep falling back into, that it can't affect me until it affects somebody right next to you, and then it shakes you up a little bit. And I'm wondering, Dr. Samuel, how we can work on that better.
That's a hard question to answer. We have two more people.
Sorry, that was a cry for help. If you didn't understand me, that's a cry for help.
Okay. All right.
One of the things that we can be also trying to encourage is these people. Thanks, Dr. Trotman. You make so much sense, and this discussion is so relevant, because I think we want to be able to be proactive, encouraging people who have been infected with COVID, who have been COVID positive, come to the forefront is a good way, because then you can hear from them the struggle, the pain, disease by no. And I think as occupational health professionals, it good that it may be helpful sometimes, to have people coming and talk about that experience, how painful it is for them and for their family. So that could be one way. And then, of course, we are role models too to people, and I'm sure you're doing your best to maintain that, the mask and the limiting going out and social distance, physical distancing, sorry. But we have two more, and then we probably have to close. This is such an interesting discussion. So I see, Amy, I don't know if I'm correct, but I see two hands still up, no?
Sure. I think next we hear from Rodney, and then Nurse Althea had a comment.
Great discussion. Go ahead, Rodney, if you had another comment. And no? Okay.
Am I on?
Yeah.
Okay, I also forgot too that sometimes with the hurricane, you find persons may temporarily lose their jobs because of infrastructure broken down or whatever, and there is temporary closure of their jobs in terms of repair and everything to the building and whatever. But with COVID, you've seen closure of jobs and nothing reopening, so this unemployment continue to increase. So the coping with stress with hurricane and COVID is different. Post-hurricane persons get laid off because repairs, and they know that, the building's been repaired and stuff like that. But with the COVID, they've been sent home and nothing reopening, so that stress, it continues. And they're left to wonder what's happening. I no longer have a job. And because of the service I give, I may no longer have a job because of the high risk of opening, like the restaurants and stuff like that, the tourism departments, they're closed. The stores and boutiques are closed because no cruise ship coming in and stuff like that. So those persons are unemployed for such longer periods. Whereas if it's just a hurricane situation, they could actually see, so there's hope because we are being repaired, so we know why we are home. With COVID, we are being home. We are home because the job we do is a high risk and there's nobody coming in, so we can no longer work. So that stress continues. So that is just, to me, can't compare. I can't compare those two. The jobs you lose post-hurricane and the jobs you lose during COVID, it can't be compared. Because there's no hope. There's no hope. So, yeah.
Yeah.
Great, thank you. And this is why we're having these discussions in terms of the importance of coping and the impact of that stress, because as Dr. Samuel was saying, then you end up having a very, chronic stress. And I think once we discussions, it becomes easier for us to prepare. And what the person was saying, it's so important that we follow health guidelines. If we plan we need to be more responsible in how we are behaving. So I think that's it for my part. This has been a great discussion. And thanks everyone for attending. I think Amy, I pass the mic to Dr. Samuel if she has something else to say. But from my part, this has been fabulous. But the mic is yours, Dr. Samuel, and then I guess Amy. Thank you.
So definitely a great discussion. Thank you, everyone who has participated. I think the key point is the stress is manageable, but we have to intentionally manage it. So, we're going to continue to have this ongoing chronic stress because of the COVID situation, but it's important for each of us to make sure we implement and practice our stress management plan so that we can continue to maintain our level of wellness. So thank you very much, and be on the lookout for the next series, which will be in 2 weeks.
Great. Thank you, Dr. Samuel, for a wonderful presentation, and for all of our participants for joining us. Please stay logged in, and we'd greatly appreciate if you help us by taking a brief survey as soon as the event ends. And it's been wonderful having you here. Have a great evening.
Thank you. I will
Thank
share the
you.
presentation and the as well as the recording. Thanks, Dr. Samuel.
Thank
It was a pleasure. Okay. Bye.
Bye. All right. Bye, Amy.